Hi dear parents, today we'll talk about how to protect yourself and your kids during this dengue season. This is Dr. Tejashwini. I'm a consultant pediatrician from Pebbles Pediatrics, Gachibowli, Kondapur. As we all know, the past few weeks to months we are seeing a rise in dengue cases. It's not like dengue is present only in rainy season, it is prevalent throughout the year, but we see more number of cases in this season because it is spread by a mosquito called Aedes aegypti, which breeds more in stagnant water, puddles. It does not require too big of a lake or a pond to breed and breed their larvae, but it needs just the few small puddles, which is why it is also called urban mosquito. Not only that, it is also a day biting mosquito, which means we have to protect ourselves during the day as well as the night. So here are a few symptoms which you need to look for in this dengue season. The signs and symptoms which we see in dengue fever are high-grade fevers, muscle pains, pain behind the eyes, pain behind the neck, lethargy, tummy pain, feeling of vomiting, that is nausea. These are the few signs and symptoms. But apart from that, there are something called warning signs which we need to look out for. These are the child becoming dull, not able to take any feed, the urine output coming down, severe tummy pain, vomitings, the rash which is spread throughout the body, any bleeding from nose, mouth, in the vomiting or in the motion of the baby. These are all called warning signs. Thankfully, most of the cases of dengue, that is more than 95% of the dengue cases, are simple dengue cases. By that I mean we can manage them at home with proper and adequate hydration. One common myth is dengue is always associated with platelet count. Everywhere we go, we say dengue, they say platelet count, because it's been going on for ages and ages that the platelets are the most important thing in dengue. Yes, platelets are important, but the most important thing more than platelet is making sure of adequate hydration, which is making sure the blood is not getting thickened. That is the one which causes complications in dengue. How do we prevent the blood from getting thicker? Is making sure you have enough amount of liquids in the form of water, ORS, coconut water, buttermilk, soups. The fact how do you measure the child is adequately hydrated is making sure the pee count is good. That is, the number of times the kid passes urine should be good enough so that you know that the child is adequately hydrated. When you see the above discussed warning signs, make sure your kid is properly looked after and might need hospitalization. Always seek your pediatrician's advice in the first 1 to 2 days of fever. If the fever is not getting down or too high grade, the child is becoming dull, or all in any of the warning signs that I have mentioned above seem to be seen in your child, please contact your pediatrician immediately. And coming to the management, like I said, 95% of cases of dengue can be treated at home but might need hospitalization in those 5% of cases. In the management of dengue, apart from good amount of liquids, you can use paracetamol for fever as prescribed by your pediatrician. Don't use too many over-the-top medicines, things like ibuprofen, aspirin or antibiotics, which are not used and can do harm in dengue. Apart from that, how do we prevent dengue? We prevent dengue through avoiding mosquito bite. How do we avoid these mosquitoes, which are urban mosquitoes and day biting mosquitoes, is making sure that your kid is covered as much as possible through long sleeves, long pants, so that the exposed area is less for the mosquito bites. You can use fabric roll-ons on the sleeves and then at the end of the pants. You can also apply the mosquito repellent creams and gels, but before that you apply it on a small area of the skin, so that making sure that your kid is not allergic to that, and then you can apply on the exposed areas as needed. Apart from that, take care of any stagnant puddles or discarded pots or canisters that are in and around your house. Make sure your dustbins are covered so that it does not become a breeding ground for the mosquitoes. And you can make sure that all the screens of the windows and doors are covered, and if there are any holes, patch them up. Apart from that, sleep under a mosquito net, especially with your kid during the nights.